It's time for the 420 Radio News, covering the latest headlines in consumer cannabis, medical marijuana, and industrial hemp. Transcripts of 420 Radio News are available daily on our website at 420radio.org. Now, here's Priscilla Simon.
And this is your 420 Radio News for Tuesday, June 17th, 2014. The final version of a medical marijuana bill in New York was submitted before midnight, qualifying it for a final vote on the final day of the legislative session Thursday. We reported yesterday that Governor Andrew Cuomo had issued a list of changes he wanted to see that mostly served to appease law enforcement concerns. The governor wanted many qualifying conditions eliminated, such as post-traumatic stress and traumatic brain injury, but only post-concussion syndrome, lupus, and diabetes were removed from the bill. Governor Cuomo wanted to ban cannabis smoking, but the new bill does not. Bill sponsors did bow to the governor's complaint that 2.5 ounces of marijuana per month was excessive, reducing the possession limit to just 2 ounces per month. Wah, wah. The governor's wish for a 5-year sunset clause was also rejected. Under the bill, medical cannabis would be taxed at 7%, patients would not be allowed to cultivate cannabis, and only 19 or fewer certified growers will be licensed statewide during the program's first 2 years.
Jeez. All right. Well, so now it's not the worst possible medical marijuana bill. It's just terribly awful. Okay. First of all, this reduction from 2.5 ounces to 2 ounces. Because, you know, that extra half ounce made all the difference, right? What do they think these patients are doing with their marijuana? Well, obviously, they think it's diversion. They think they're selling it. But really, does a half ounce make that much difference? I don't see how that's a big deal. This other thing, 19 or fewer certified growers. We're talking about a state with 20 million people, so less than one grower per 1 million people. Even if 1 out of 1,000 people get medical marijuana, that's 1,000 people per grower, right? There's just no way they'll be able to keep up with any sort of patient demand. Of course, maybe the idea isn't to have that many patients for that much demand. It sounds like it to me. And then taxing medical cannabis at 7%, you know, there's always that question about whether or not medicine should be taxed. And, you know, if it's going to be a strictly medical program, I think that's a little cruel to be trying to raise money off of the sickest and most disabled people. And then not allowing lupus or diabetes or post-concussion syndrome. It just always angers me when we have legislators and governors and law enforcement people trying to decide what the medical application of cannabis should be instead of doctors. You know, why don't we just let doctors decide what is going to work best for her and leave it to them? It's not like they're dispensing oxycodone or something that's terribly addictive and you know, terribly harmful to one's liver or to one's health. You know, we treat it like it's plutonium, for God's sake. It's just crazy. I mean, Colorado hasn't fallen apart since you guys had medical, and now you've got legalization. Doesn't look. What was the headline I saw, that there wasn't pot zombies roaming your streets in search of strains?
No pot zombies, and I mean, 19 million tax dollars raised. I mean, there's kids getting iPadded. Every single kid is getting an iPad in schools, and I don't think they're complaining.
I guess not.
While the New Approach Oregon campaign has raised over $1 million and surpassed 100,000 signatures, the other legalization campaign in Oregon is beset by labor controversy. The Campaign for the Restoration and Regulation of Hemp, or CRRH, was picketed by its signature gatherers who walked off the job last week. The United Campaign Workers, or UCH, posted a demand letter to CRRH complaining of late and bounced paychecks and CRRH's failure to reimburse for travel expenses. CRRH is gathering signatures for Initiative 21, a constitutional amendment called Help End Marijuana Prohibition, or HEMP, and Initiative 22, a statutory legalization called the Oregon Cannabis Tax Act, or OCTA. HEMP has submitted 43,000 of the over 116,000 signatures needed, and OCTA has submitted just 34,000 of the over 87,000 signatures it requires to qualify for the November ballot. UCW also wanted to discuss, quote, why we've continued on hemp so late in the game and if it's going to fail, end quote. On Monday, UCW offered to return to work unconditionally, but were locked out by CRRH management. UCW says the lockout is illegal and will be filing a complaint with the National Labor Relations Board. CRRH did not return 420 Radio News' request for a comment.
Wow. All right. So this is difficult. We got New Approach Oregon. It seems to be, going just fine toward legalization. $1 million raised, 100,000 signatures. CRRH, they're the same group that put the legalization on the ballot in 2012 that was also beset by campaign problems. Nothing as severe as this, but had funding issues. And while it made the ballot, it failed in the vote with just 46.5%. And it's a shame to have to report on this and these things going on because everybody involved with CRRH has the right intent in wanting to legalize marijuana and to try to come up with the best, constitutional protection for that and legal protection for that. But imagine if we hadn't, if we had heeded the advice of national funders who said, don't go for 2014. If New Approach Oregon had waited and not gone for 2014, this would be the only legalization story in Oregon. A story of unpaid campaign workers and bounced checks and frivolous amendments that aren't going anywhere and signature counts that with just 3 weeks left have less than a third and less than half of what they need to qualify for the ballot. We didn't need to have that kind of continued additional failure propagated through the airwaves with respect to Oregon legalization. So kudos to New Approach for stepping up and running a responsible campaign, running a campaign professionally with some big pocket funders and giving us something to focus on aside from the continued failures of CRRH.
Safer Arizona, a grassroots coalition of 4 volunteer organizations, has called off its signature gathering campaign to legalize marijuana in 2014. The group explained that they had only gathered around a third of the signatures it was seeking. Arizona law requires over 250,000 signatures to place an initiative on the ballot. As a volunteer effort, the group explained it did not have the manpower and money required to complete a statewide initiative drive. However, the group is resolved to fight for legalization in 2016 by allying with the Marijuana Policy Project, the national advocacy group with deep pockets that put medical marijuana on the ballot and won with 50.13% of the vote in 2010. Over the next couple of years, we will be building a broad coalition of community activists, local leaders, organizations, and businesses that are committed to passing a law that regulates marijuana similarly to alcohol, end quote, said Mason Burt, Director of Communications for the Marijuana Policy Project.
Well, this is just another illustration of folks that have the best of intentions, grassroots groups that want to try to legalize marijuana, but fail to realize or accept that that requires money. You got to have big money to pull these things off, and it shouldn't be that way. Democracy should be open to all us as volunteers, but anytime you hear an initiative campaign that comes out and says, well, if we only get, and that's always followed by, every person to fill out 100 sheets, or if we only get $10 from every supporter, or if we only is code word for we can't do it. That's what it's code word for. You need to start these things out before you even start proposing legalizing marijuana. You've got to get the coalition built. You've got to get the funders in line. You've got to have major support from national organizations, and then you move forward. The only legalization that went anywhere without that kind of game plan was Proposition 19 in 2010, and even that was bankrolled by Richard Lee, pouring $1.5 million of his own money, his life savings, into getting it on the ballot, and it damn near succeeded. This is too important, and people's lives and time is too important to get them all amped up and hopeful for a legalization that has no chance of making it anywhere or getting on the ballot. Let's get serious about this. Washington and Colorado have laid the blueprint for how this is done. We need to follow that blueprint and get legalization in as many states as possible as soon as possible.
And Governor Chris Christie said Monday on his monthly radio show that medical marijuana, quote, is a fallacy. and all state medical marijuana programs, quote, are a front for legalization. New Jersey's medical marijuana program is one of the most restrictive in the nation, a point that was made recently in newspaper editorials. One woman's op-ed explained how New Jersey's strict rules cost her daughter's life. One newspaper said that the medical marijuana program is, quote, on life support because so few doctors and patients will enroll. For Governor Chris Christie, however, low enrollment isn't a sign of his failure to implement a workable program. It's confirmation of his anti-medical marijuana bias. Quote, what there's a huge demand for is marijuana, not medical marijuana, said the governor, because when we run a medically based program, you don't see the demand, end quote. Last week, the president of one of the state's 3 dispensaries quit, complaining he'd been working for 3 years for no pay since lack of patients couldn't keep the business afloat. Governor Christie mocked that complaint, asking, quote, what did these folks say? They weren't making enough money. You know, if this was a medical program, what's everybody worried about making money for? End quote.
Yeah, because, you know, all those hospitals in New Jersey, they do it just for free. All those CEOs of Humana and Aetna and United Health, they just show up to work and do it for free. All those doctors and nurses in the emergency rooms, why, they just show it up for free because it's a medical program. Nobody's really worried about the money, Governor Christie. Why is that only a complaint for a medical marijuana business? And we're not even talking about a guy who was trying to get rich. He worked for 3 years for no pay, volunteering, trying to help the sickest, most disabled people in your state that you, Governor Christie, keep putting roadblocks in front of. This is a self-fulfilling prophecy when you make your medical marijuana program so shitty, nobody wants to get on it and nobody can get on it. And then you crow about, see, nobody really wants medical marijuana if you make it medical. Oh, give me a break.
That was well said. Congress does not appear to be willing to overturn the District of Columbia's marijuana decriminalization law. The new law was signed by the mayor on March 31st and is currently under its required 60-day review by Congress, which has a final say over any laws in Washington, D.C. Under the new law, as of July 17th, any adult 18 years of age or older caught in possession of an ounce or less of marijuana is subject to only a $25 fine and the confiscation of their weed. No members of Congress have stepped up to sponsor legislation to block the decriminalization, perhaps heeding the nation's change in sentiment after a 219 to 189 vote in the House to defund DEA raids on medical marijuana states. Congress's newfound relaxed attitude toward marijuana in D.C. may be put to the test this November. However, when district residents may be voting on full-scale marijuana legalization. No, sorry to beat that up for you.
No, that's fine. No, you know, this is good news that Congress doesn't want to mess around with this. But boy, can you imagine in Washington, D.C., they're going to have medical marijuana dispensaries and $25 tickets for marijuana possession. Yet in Congress, they'll still be arguing to keep marijuana prohibited and going after the people who are trying to legalize in the rest of the United States. This can't stand. It's gonna change very quickly from here on out, folks. That's really, really good news. Thank you so much, Priscilla.
Yeah.
It's 4:20 in Denver, Colorado. I'm sure you've got important business to attend to. We're going to take a break here ourselves, and when we come back, we'll go behind the headlines and take a look at Child Protective Services in legal